Hello everyone, my name is Ala Sayed. I'm a fourth year medical student at King Saud bin Abdulaziz University for Health Sciences. And today we're going to talk about the blood supply of the brain and the blood supply of the spinal cord. Now we will start by the blood supply of the brain. Now the blood supply of the brain is divided into two systems, the anterior system and the posterior system. And we will discuss each system one at a time. Now, before talking about the posterior system, let's talk about some basic anatomy. Now, let's start with the heart. The heart will give you the ascending aorta, and after that, the ascending aorta will actually give you three branches. Now, the first branch is called the brachiocephalic artery, and the brachiocephalic artery will then give you two other branches. The first, which is the right subclavian artery, and the second, which is the right common carotid artery. However, on the left side, the aortic arch itself is what gives you the left common carotid artery and the left subclavian artery as the second branch and the third branch of the aortic arch. Now, let's talk about the posterior system. Now, it all starts actually from the subclavian arteries, as you can see here. Now, the subclavian arteries will go and give us two arteries. The right will give you a branch, and the left will give you a branch. Those two arteries are called the vertebral arteries. The vertebral arteries will then continue their path upwards towards the cranial cavity. So how does each vertebral artery enter into the cranial cavity? Now let's start by the subclavian artery. It will give you the vertebral artery. The vertebral artery will actually ascend through the neck, through the foramina of the transverse processes of the vertebrae, as you can see here. It will go through the foramina of the upper 6 cervical vertebrae and then enter into foramen magnum, and through foramen magnum it enters the cranial cavity. Now after the artery actually enters the cranial cavity, as you can see here, it will actually pierce the dura and the arachnoid matter or meninges to reach the subarachnoid space. So as you can imagine, all the cranial arteries are actually floating within the subarachnoid space. The two arteries then pass medially and forward to lie on the anterior surface of the medulla oblongata. Here's a picture of the brain stem. So here's the midbrain, pons, and medulla oblongata. Here's the vertebral artery. This is one branch and this is the other branch. It's important to mention that behind the brainstem, as you know in your general anatomy, we have the cerebellum. So let's just draw something like this. This is the cerebellar hemispheres. Okay, now let's go back to our vertebral arteries. Now, first of all, the vertebral arteries came at the anterior surface of the medulla oblongata, as we said, and as you can see in the structure. Now, when they go on the anterior surface of the medulla oblongata, the two arteries will move upwards until they reach the pontomedullary junction. So the junction between the pons and the medulla. Here is where the two arteries will actually join each other, as you can see here, to give you another artery called the basilar artery. Now we will go to the basilar artery in more details in a while, but let's continue with the vertebral arteries. Now let's take the branches of the vertebral arteries. Now the vertebral arteries have 4 branches. Let's start from down and move upwards. Okay, now the first branch is actually called the posterior spinal artery. So each vertebral artery, as we can see here, will give you one posterior spinal artery. So eventually you have 2 posterior spinal arteries. Why is it called the posterior spinal artery? Because it will actually go from here towards the posterior surface, continue downwards towards the spinal cord, and then supply the posterior surface of the spinal cord. In particular, it will supply the posterior third of the spinal cord. Now, let's move upwards through the vertebral artery. Now the vertebral arteries, the right and the left, will actually give small branches that will join each other to give one artery that will move downwards. Now this artery is called the anterior spinal artery, and it's the second branch of the vertebral arteries, and it's only one single artery, unlike the posterior spinal arteries. So, the anterior spinal artery, as it continues downwards, will actually pass through the anterior median fissure of the spinal cord. And it will supply the anterior 2/3 of the spinal cord. The third branch of the vertebral arteries is called the posterior inferior cerebellar artery. Now, it's called inferior because it supplies the inferior surface of the cerebellum. And it's also called the posterior, as you can imagine, because it supplies the posterior surface of the cerebellum. So if we imagine this is the cerebellum, it will supply the inferior surface of it and also the posterior. And it will be more clear in the second picture. An important information to mention here is that the posterior inferior cerebellar artery is actually the biggest branch of the vertebral arteries, and you can see it sometimes in other references as a PICA or PICA, and this is just an abbreviation. And another important information to mention, the posterior spinal artery sometimes in some people actually originate from pica rather than from the vertebral artery. So just memorize it. Posterior loves posterior. Now, to the last branch of the vertebral arteries. It's actually not shown in the picture, but it makes sense that if the vertebral arteries are passing on or on the anterior surface of the medulla oblongata, that they will actually give branches to the medulla oblongata. So the vertebral arteries will actually give you medullary arteries to supply different parts of the medulla oblongata. Now, moving to the basilar artery. As previously mentioned, it formed from the union of the two vertebral arteries at the pontomedullary junction. Now, as it moves upwards at the anterior surface of the pons, it will give you an anterior inferior cerebellar artery, which will actually supply the inferior and the anterior surface of the cerebellum. And as it moves upwards, it gives its second branches called the pontine arteries because it passes on the pons. Now, the pontine arteries are actually two types. One called the paramedian arteries, which will supply the median area of the pons, and the long and short circumflex arteries will actually supply the lateral parts and then move towards the posterior surface of the pons and supply the posterior surface. Now, and then as the basilar artery moves upwards, it will give another branch called the superior cerebellar artery. So as you can compare here, the superior cerebellar artery is only one single artery, unlike the inferior cerebellar arteries, which are two, one anteriorly and one posteriorly. Okay? And then, after giving the superior cerebellar artery, the basilar artery will finally divide into its terminal branches at the midbrain. Those terminal branches are called the posterior cerebral arteries. Here is a better picture so you could imagine what I just said. Let's just recap quickly. So the two vertebral arteries will give you four branches. The first, which is the posterior spinal artery, it is a paired artery, one on the right and one on the left. When the two vertebral arteries join each other, in the middle they will give you one single anterior spinal artery. And this is the second branch of the vertebral arteries. The third branch is actually the posterior inferior cerebellar artery. So here is the posterior surface of the cerebellum, and also the inferior surface of the cerebellum. And that's why the artery is called the posterior inferior cerebellar artery. And at last, it will give you medullary arteries here to supply different parts of the medulla oblongata. Moving on to the basilar artery. The basilar artery will give you the anterior inferior cerebellar artery, supplying the inferior but anterior surface of the cerebellum. And as it moves upwards, it will give you pontine branches supplying the pons, and then it will give you the superior cerebellar artery. And this artery will actually supply, as you can see here, the superior surface of the cerebellum. And at last, the basilar artery will actually divide into its two terminal branches called the posterior cerebral artery. Now, let's talk a bit about the posterior cerebral artery. What does it actually supply from the brain? Now, it has two main branches. Some branches are called cortical branches because they supply parts of the cortex, and other branches are actually called central branches. Now, the central branches, instead of supplying parts of the cortex, they supply deeper structures within the brain. For example, here, the posterior cerebral artery will actually supply parts of the thalamus, parts of the lentiform nucleus, parts of the midbrain, and also it supplies the medial geniculate bodies. Let's then take the cortical branches of the posterior cerebral artery. Starting from the origin of the artery actually originates from here. Now, here is actually the temporal lobe. Here's the occipital lobe. After removing the temporal lobe, here the temporal lobe is cut from here and removed, and you can see the occipital lobe. So let's take the origin of the artery. The artery starts here, and as it moves, it will actually supply parts of the medial surface of the temporal lobe. And then it will move laterally to supply the inferior surface and the lateral surface of the temporal lobe. So it will eventually supply the inferior lateral surface of the temporal lobe. After supplying the temporal lobe, some branches, as you can see here, will move deeper to actually supply the occipital cortex or the occipital lobes. Now, here's a summary of the branches of the vertebral arteries. You can go through them yourself. This is also a summary of the basilar artery branches. You can go through it yourself. Moving to the anterior circulation. The anterior circulation all starts when the common carotid artery gives its two branches, the internal carotid and the external carotid, at the carotid sinus. Now, the internal carotid artery will enter the cranial cavity through the carotid canal and the temporal bone. And from there, the internal carotid artery will actually supply the whole anterior circulation. So this is the common carotid artery, this is the carotid sinus, and here's the external carotid artery, and this is the internal carotid artery. Now let's talk about branches of the internal carotid artery. Now the internal carotid artery will move upwards and enter the cranial cavity, where it will also pierce the dura and arachnoid matter to go to the subarachnoid space. And from there, it will actually give its first branch, which is called the ophthalmic artery. Now, the ophthalmic artery will actually enter the eye through the optic canal and supply the eye, and it will give a branch called the central retinal artery, which will supply the retina of the eye. The internal carotid artery will then divide into its two terminal branches. One, as you can see here, that will move actually anteriorly in the cranial cavity, and the other will actually move laterally in the cranial cavity. The one moving anteriorly is called the anterior cerebral artery, and the one moving laterally is called the middle cerebral artery. Now, before continuing talking about the two terminal branches of the carotid, we will talk about two other branches that the internal carotid will actually give just a while before it gives the two terminal branches. The first branch is called the choroidal artery. It actually supplies the choroidal plexus of the lateral ventricle. And the other branch is called the posterior communicating artery. Now, the posterior communicating artery will actually join the middle cerebral artery with the posterior cerebral artery. It will make like a communication between those two arteries, as you can see in the figure here. We will mention this branch again in a while, after we just continue talking about the two terminal branches. Okay, so here is the internal carotid artery. It will give off two branches, one moving laterally called the middle cerebral artery. It's important to mention it is the biggest branch of the internal carotid artery, and the other branch moving anteriorly called the anterior cerebral artery. Now, let's start by the anterior cerebral artery. Now, like the posterior cerebral artery, any cerebral artery actually has two branches, some of which are cortical or superficial branches supplying the cortex, and others are deep or penetrating, or as we call central branches. Now let's start by the first branches, which are the cortical branches of the anterior cerebral artery. Now, as the artery moves anteriorly, the two arteries, the one on the right and the one on the left, will actually be joined by an anterior communicating artery. So basically, this anterior communicating artery will just join the right branch with the left branch. So then the artery will actually move medially, as you can see here, and anteriorly. And as it's moving medially, it will actually supply the medial surface of the cerebral cortex. Okay, and not only does the artery stop there, it will actually start supplying a bit of the lateral surfaces of the cortex, and it will supply the medial surface of the cortex starting here and moving backwards toward the parieto-occipital sulcus. So as you can see, here's only one brain hemisphere, and this is the medial surface of the hemisphere. So the anterior cerebral artery will actually come and move anteriorly to supply the medial surface of the brain, and then it will curve above corpus callosum to supply the medial surface from the area behind up to the parieto-occipital sulcus here. Okay? Not only that, after supplying the medial surface, the anterior cerebral artery actually curves a bit laterally to supply only 1 inch from the lateral surface of the hemisphere. So this is a repetition of what I just said. Focus on the yellow. The yellow is the anterior cerebral artery territory. So as you can see, the anterior cerebral artery went to supply the medial surface, and it also went back up to the parieto-occipital sulcus to supply all the medial surface of the brain. Here, you can see that the anterior cerebral artery even came laterally. This is because this is the lateral surface of the brain. It came a bit laterally to supply the lateral surface of the hemisphere. So it supplies about 1 inch or 2.5 centimeters of the lateral surface of the brain. So this is one cerebral hemisphere. This is called the homunculus, or it just represents which parts of the brain actually controls what. And let's just take the brain supply. As you can imagine, this will be the anterior cerebral artery moving this way and supplying the medial surface. This is medial and this is lateral. Okay, so it will supply all this medial surface of the brain, and it will only take, as you can see here, like about an inch, like up to here, an inch of the lateral surface. So this is the lateral surface. It will just take about an inch. So eventually, as you can imagine, you end up with only supplying the legs and the genitals and the hip. So the territory of the anterior cerebral artery is actually just supplying the hip area, the legs, the genitals. So if this artery was occluded, you would imagine that the patient will have symptoms only in his hips and legs, while the trunk, arm, elbow, forearm, hands, fingers, whatever, all the rest are spared. So let's start talking about the middle cerebral artery. Now, as you can see here, first, this is the temporal lobe, and the temporal lobe is separated from the parietal and frontal lobe by a lateral sulcus, as you can see here. Now here in this part, the temporal lobe is actually removed, so you can see the artery itself. So let's start taking the artery. The middle cerebral artery will move laterally, as we previously mentioned. When it moves laterally, it will actually go within that lateral sulcus and move outwards laterally toward the lateral surface of the hemisphere. When it reaches the lateral surface, as you will see with the next pictures, it will give branches upward and branches downward to supply the lateral surface of the hemisphere. Now, those branches are called the cortical branches, which supply the cortex, or the lateral surface of the cortex. Now, the other branches, which are central branches or penetrating or deep branches, are these branches. They are the branches you see when you actually remove the temporal lobe. Those branches supply deeper structures within the brain, like lentiform nucleus, quadrate nucleus, and internal capsule. Let's now take the brain from the lateral surface. As you can see here, here's the internal carotid artery giving you the middle cerebral artery. The middle cerebral artery moved through the sulcus and moved until it reached the lateral surface of the cortex. You can see it more clear here. When it came out of the lateral surface, it started giving off branches upwards this way and downwards to supply the whole lateral surface of the brain. Now it will actually supply the whole lateral surface of the brain except for the areas supplied by the anterior cerebral artery and the other areas supplied by the posterior cerebral artery. So those are the cortical branches. Now how about the deep branches? The deep branches are actually, as you can see here, they're also called the lenticular striate arteries, and they are end arteries. Here's the medial surface of the cerebral hemisphere. So the middle cerebral artery, as you can see, it won't supply that much of the medial area except for like a small bit of the medial area. But laterally, as you can see here, the middle cerebral artery will actually supply all the lateral area of the hemisphere except for the area supplied by the anterior cerebral arteries and the area supplied by the posterior cerebral artery. Now, what is supplied by the anterior cerebral artery? We mentioned only 1 inch is supplied laterally by the anterior cerebral artery, and the posterior cerebral artery will supply the parts of the occipital cortex and the parts of the inferior lateral part of the temporal lobe. Again, the territory of the middle cerebral artery will include everything but the legs. So you can get a wide variety of symptoms. Maybe if the patient gets a stroke, you can get facial drooping, anything else, but the legs and hips are spared. What is the circle of Willis? Basically, just understand the concept of the circle of Willis. The circle of Willis is just a means by which the branches of the internal carotid arteries and branches of the vertebral arteries can communicate or exchange blood in case one artery got occluded. Let's imagine the posterior cerebral artery got occluded from here. Then blood through the internal carotid can actually move this way through the middle cerebral artery and through the posterior communicating artery to the posterior cerebral artery territory and supply it. This is actually the blood's homeostatic mechanism to avoid injury. So the circle of Willis is actually a communication between the anterior system and the posterior system. And what helps that actually is the posterior communicating artery, linking both the middle cerebral artery with the posterior cerebral artery. So this is the posterior communicating artery. So what are the contributors to the circle of Willis? The internal carotid, vertebral arteries, the anterior communicating artery, the anterior cerebral artery, middle cerebral, posterior communicating, and posterior cerebral arteries, and also the basilar arteries. This is another summary. You can go through it yourself, and this is also a continuation of that summary. Now to the blood supply of the spinal cord. The blood supply of the spinal cord is basically through 3 main arteries: the anterior spinal artery, the paired posterior spinal arteries, and also the segmental arteries. The anterior and the posterior spinal arteries, as we previously mentioned, are branches of the vertebral arteries. The anterior will supply the anterior 2/3 of the spinal cord, while the posterior will only supply 1/3 of the spinal cord. The anterior spinal artery will pass through the anterior median fissure, while the posterior spinal arteries will pass through the posterior lateral sulci of the spinal cord. Now, what are the segmental arteries? The segmental arteries are actually arteries that enter through the intervertebral foramina and actually reach the spinal cord itself, or the spinal cord matter. Now, they're called segmental arteries because each artery actually supplies a segment of the spinal cord. As the segmental arteries enter the segment, they divide into 2 branches, one posteriorly and one anteriorly. The anterior branch is called the anterior radicular artery, and the posterior branch is called the posterior radicular artery. Both arteries supply the anterior and the posterior roots of the spinal nerves, respectively. Where do those segmental arteries actually originate from? Now, the segmental arteries have different origins depending on which part of the cord are we talking about. So, in the cervical region, the segmental arteries actually come from the deep cervical arteries. In the thoracic, they come from the intercostal arteries. In the lumbar regions, they come from the lumbar arteries. And sometimes they come as direct branches of the aorta itself. Now, there's a special artery we need to mention. It is actually the biggest segmental artery. This artery is actually called artery of Adamskiewicz. The artery of Adamskiewicz is also called the great anterior medullary artery of Adamskiewicz. Now, it arises from the aorta at the level of T12, and therefore it supplies the lower regions of the cord, like the lumbar and sacral regions. This artery is very important for the supply. So if it was injured in surgery or something, the cord is more prone to ischemia when this artery is injured. Those are the references I used. Many of the things in the tables are actually copied from those references. I found them really great in explaining this topic. Those are the references I used. Now, if you have any question, comment, suggestion, you can contact us through this email.